Good afternoon. Welcome to the Tennessean Bizcast. My name is Lance Williams, business editor here at the Tennessean, joined today by Etan Ward, business reporter. I'm glad you could join us.
Yeah, it's good. Good to be.
I want to ask you a few questions. I know you've been chasing a story, and it made big news this morning, but it's some issues with the Medicare program. And some challenges with that program, and it gets fairly technical, so we'll try to break it down. But it's issues with the what they call the competitive bidding program. Can you tell us a little bit about sort of what competitive bidding is and why it's such a big deal?
Yeah, well, it's a program Medicare designed essentially to try to reduce the cost of what they pay for all type of medical supply, from oxygen tanks to hospital beds and diabetic supplies and so forth. And the intention was to reduce costs because anybody could set up shop and supply and to some extent get paid for it. So they felt like by going to fewer vendors, they could cut costs by dealing with a select group of what they consider quality, but also a group that they were able to take bids and determine a median price for the supply. So because they found that Medicare was paying a lot more than private insurers were paying for the same item. So they figured by reducing the number of suppliers and at the same time setting a lower price that it would pay for these supplies, they would save at least 25 billion over 10 years.
So it's big savings for the program, but for a lot of local companies, they were concerned because the prices were going to be lower, and then from what I understand, some of the companies are no longer going to be able to supply these patients because they didn't win one of the bids.
Yeah, and estimated 85% of the vendors in Tennessee were not among those selected. And so a lot of these companies starting July 1st technically won't be able to get reimbursed by Medicare, although because of a little tweak in the program, if they already had a client, if they elect to choose a certain status, they could still finish up that term of that particular supply with that particular patient until it's over. But yeah, a lot of them weren't selected, so that you, as you can understand, there's been a lot of effort to either get this program canceled altogether or to get it changed, and so that's what the industry group had been lobbying for. They haven't been successful so far in Congress to get a bill passed to stop it or replace this competitive bidding system. So they've looked at other ways to kind of look at how they can stop it from going into effect. And one way was a licensure issue that surfaced in Tennessee. And when CMS, the Medicare overseer, came up with this program, they had some rules on the books that you had to be licensed in states in which you're bidding. But apparently, they didn't follow those rules as closely as they should have. And so after the industry group brought pressure and asked the congressman from Tennessee to write letters to CMS finally admitted last Friday that they didn't make a mistake in a way with the licensure issue. And as a result, they are avoiding contracts with about 30 of those 98 companies that were selected. Most of them are out-of-state companies who didn't have a presence here, and at the same time, they didn't have a license to do business in Tennessee.
Now, the Tennessee companies that lost the initial bids, will they be able to get back into the program, or are they still shut out right now?
Well, so far, CMS, Medicare overseer, haven't really said they're going to do any new bidding. They feel that because they selected a certain number of vendors, they feel like those will be enough to still handle the business come July 1st. But there's some concerns, even from members of Congress from Tennessee, that if you slash in those number of providers by a third, and you had already dramatically shrunk the numbers of people around the country that could do this supply work, then would that be enough to go around, And I think some of the industry is also concerned about the time frame to get products to customers. If some of these companies that want in other parts of the country, how do you get an oxygen tank to the hospital just in time for the person to be leaving?
If they're having to ship one in from Maryland, it's going to take a lot longer.
Yeah, so those are the concerns.
All right. Now, I know that you talked about the industry group that would like to kill it all together, and they haven't been successful so far. But even it's my understanding that members of Congress are pushing for another type of solution. I guess delays or just trying to,
Yeah, yeah.
since we're only about 2 weeks away from that July 1st deadline.
Last week, more than 200 members of the House sent a letter to Medicare's overseer, CMS, just asking that the program be delayed because there are a lot of concerns. There are concerns about even the structure of the program because this whole idea of having anybody bid and pick the low or high point. So some of these vendors think is actually skews the median bid because some companies may have just bid low in order to get the contract, but they weren't in the market to know what the prices were. And so there's concerns about transparency of the program too. In terms of a lot of the vendors here say, well, they don't even know what were those bids that were submitted, that the price now is being based on. So even the winner's gonna see a dramatically decline in their revenue because, they're being paid 45% less for 9 categories of products, and it's even 72% less for diabetic supplies. So as a result, there was a bill introduced in Congress that want to replace this competitive bidding system with a so-called market-based pricing system, and they feel like it's a better approach, but it don't look like it's gaining a lot of traction. But we can stay tuned and see what influence the congressman will have, in changing this.
All right, very good. Well, we appreciate so much. It's been very helpful to help us sort of get a handle on that, and I know we'll be following it in the next several weeks to see what happens with this program. We thank you for joining us today. Invite you back to our website at Tennessean.com every day for webcasts on a variety of topics from politics to sports to entertainment and, of course, business. We thank you for joining us, and we hope you have a great afternoon.